Hospitals already facing another COVID surge and crowded ICUs may find themselves with another challenge this weekend. Starting Friday, healthcare workers must have at least one dose of a COVID vaccine or an authorized vaccine exemption, according to an August order by the California Department of Public Health. If they don't, they can't show up to work.
Any loss of any of our caregivers is a very significant concern. In this case, it's qualified or amplified as a result of the vaccination question.
Across Dignity Health's Memorial and Mercy hospitals, just over 80% of workers have at least one dose of the vaccine. 10% of Mercy Hospital's workers have been approved for an exemption, and the rest are unaccounted for or have pending exemption requests. At Adventist Health, those numbers are a bit higher.
We're sitting in a really good position. We're down to really less than 10 people across our health system who we have an unknown status for.
Healthcare workers are required by the order to be fully vaccinated. Workers with a vaccine exemption or an incomplete vaccine dose will need to test twice weekly and wear a mask. Consequences are steep. If a worker is unvaccinated without an exemption, they will be placed on administrative leave until January or until they get vaccinated or secure an exemption.
If none of those things become true, those folks could be terminated in January.
Keller said Dignity Health plans to address possible staffing shortages by bringing in traveling healthcare workers and extending shifts for those willing. Now, I want to make something clear here. Those workers that have an exemption or have an incomplete vaccination status will have to continue to wear a mask and test twice weekly unless or until they become fully vaccinated. Otherwise, they could be subject to the repercussions facing non-exempt unvaccinated workers. Live at Dignity Health Mercy Hospital, Tris Burton, 17 News.